You can stay, if you're doing a renal, in some clinical settings, you'll do like a left kidney spleen interface and a right kidney liver interface to show the difference between the echo textures. Now, when we do an abdomen complete exam, that's when you're gonna do your spleen. So when you do an abdomen complete exam, you're just gonna leave it in abdomen. So we're gonna have our patient turn up towards us, just like we're doing the left kidney. Gonna roll a little bit towards you. Okay. So that's actually a little too much. I like to have my patient kind of oblique. Perfect.
Y'all need my. Alright, I just like that. I gotta use my foot like as a kickstand.
Okay, so we're gonna go back to our abdomen.
Okay, is this too much?
Alright, there we go. It is changed.
So the priest says just abdomen?
Abdomen, very good, yep. Okay. So this thing that kind of looks like a liver,
Yeah,
right
it's
next
just
to,
like the liver, doesn't it?
Yep, same type of parenchyma. So this is our left kidney. My probe is slightly angled, just like we're looking at the left kidney. Remember, our kidneys kind of come down toward, with the inferior towards the belly button. So we're still kind of angled. You see your kidney and sag right here. So that's how you know you're in the same plane for your spleen. You're just gonna come up a rib space. If I wanna see the kidney, I'm down a rib space. I wanna see the spleen, I just come up a rib space. So her, I don't really need her to take a breath in and hold it, but I don't want there to be motion. So I'm just gonna ask her to stop breathing right where she's at. You can go ahead and breathe. Where you see the vessels come in, that's gonna be your medial. I'm angling a little bit towards her midline, okay? You're gonna be putting color on just to show that there's color flow.
I know, that one's always like high.
We only need to cover up the hilum. So right there you see your vessels coming into the spleen. So this is your medial picture. We're gonna take the color off and ask her to stop breathing right where she's at. Go ahead and breathe normal. I just angled a slightly bit more laterally to get to the mid. This is gonna be the longest, biggest, widest portion. You're gonna measure your spleen, the length of it, just like we measure the length of the liver, how I showed you guys. We didn't have to do it for the test, but that's how you would measure the liver. You're gonna do the same thing and show your spleen length. Go ahead and breathe small breath in and hold it. So that's our medial with the vessels. That's our mid, the biggest, longest part. Then we're gonna angle a little bit lateral, let our patient breathe. That's gonna be your lateral part. So you're gonna do your mid with vessels with color. You're gonna do your, your medial with the vessels coming in with the color. Your mid is gonna be the biggest, longest part of it, and that's gonna have the measurement. Your lateral is just gonna be a little bit lateral on the patient. So now, when we do our transverse, we're not gonna be perfectly transverse on her. Wherever we see the mid, the biggest, longest part of that spleen, this is how our transducer is positioned. We're gonna turn 90 degrees from this position. Okay, so we're not perfectly transverse on her. We're 90 degrees from the first mid picture.
And those are ribs?
These are your rib shadows right here, yes. So we're gonna have our patient take a very small breath in and hold it. Go ahead and breathe, actually, sorry. Change our okay. So we're gonna have our patient take a very small breath in because we want to push that spleen down under those ribs just a little bit. This is gonna be your superior. We're angling slightly up. Go ahead and breathe normal. This is gonna be your mid. Just like the kidney, at your mid, your vessels come in. So you know how when you're doing your kidney and you're at medial, the vessels come in, and then you're at mid transverse, the vessels come in. Same thing for the spleen. So right here's your vessel. This is your transverse. You're going to measure from the outer edge of it, just like the kidney. And then this is your vessel. You're gonna go perfectly lateral to your vessel. That right there would be your transverse spleen measurement. And then we're also going to do color of the vessel. And you can breathe normal if you're holding it. So this is pretty similar to our kidney protocol, right?
Yeah.
Okay, so when we're in sagittal, medial, our vessels come in. When we're in transverse mid, our vessels come in. We're gonna measure it just like we do with the kidney. You see your vessel, you're gonna go perfectly lateral, and then you're gonna measure to the edge, okay? Now when you do your inferior, you're just gonna angle down, and then you're gonna start seeing your kidney,
Okay.
okay? And then that's gonna be your inferior and you're done.
Where's the kidney?
Right
That
there.
little center?
Yeah, this is your superior kidney. So now we're at superior, superior, mid, you see your kidneys like a C, inferior, inferior. So when you start seeing your kidney, you're at the inferior spleen, okay? Because your spleen's just above your kidney. Not too bad, right? This is a nice short and sweet organ.
So it's 6.
Yep.
1, 2, 3, 1, 2.
Well, plus your color pictures and your measure pictures, but yeah.
Okay.
Nice, short and sweet. They're never gonna order just a spleen. It's always gonna be part of your abdomen complete exam, okay? So when you guys are scanning your left kidney, just kind of be mindful of that spleen and just kind of take a peek around at it. All right, and then we'll practice that spleen more when we start practicing our abdomen complete exam. Alrighty, so you guys can